All right, let me first again welcome back Dr. Wile and Chuck. He is our distinguished staff physician, medical director at our Integrative Health Center. He is a retired Air Force colonel and Air Force physician, very senior physician with decades of experience. And today he will tell us about men's anti-aging. Testosterone, androgen, and which I have been, very much interested as well because I'm getting old. Not okay, Dr. Wile.
Hello, good to speak with you again. I am going to focus today on bioidentical hormone therapy, replacement therapy for men. We focused on the sex hormones for women, and today we're going to talk about testosterone and estrogen for men. And these are very key to general health and well-being. It's put in the context of anti-aging medicine, preventive and restorative medicine, and the basics of fundamental medicine, where you're looking to find the cause of problems rather than just simply treat symptoms. About 15 years ago, I had an appointment with my own physician, and my wife suggested that as part of my laboratory work, I asked for a testosterone level. I said, what do I need a testosterone level for? I feel great. I got good sexual energy, and it just didn't register as something significant at that time. And lo and behold, my lab study came back less than 200. According to the urologist at that time, you were testosterone deficient if your level was below 300. Since then, I've learned that what you're really looking for is a testosterone level in men greater than 500 to get the cardiovascular protection. But mine was less than 200. And so I went and was started on testosterone replacement by a topical testosterone. And within a week, I could not believe in my retrospective assessment how significant a change my overall well-being and sense of strength, endurance, and energy was. Looking back just a week in the past from when it was a level of 200 and comparing to where I was now, it was like I was only operating maybe 50% of my energy level, and now it was just remarkable, the change. And so this initiated my interest in the power of hormones, and I started taking some courses on the use of bioidentical hormones for men and women in general health and well-being. And it was put in the context of a big system approach for health and well-being, which includes, but we're not going to focus on today, diet and supplements, the importance of sleep, the importance of exercise, good clean water and hydration, breathing, getting into nature, putting my feet on the ground, literally looking at my whole lifestyle and making some changes and adjustments. The reason I like to start with hormone replacement is because it gets you feeling good quickly. And it's so remarkable that then I became interested in learning about other lifestyle changes that have continued to help me feel better. And after my training, then I started offering this to my patients. And so I've been using hormone replacements therapy with my patients for probably 12, 13 years now. And as a result, I find that people are dramatically feeling better in all aspects of their lives. For men, testosterone is our main sex hormone. It starts to decline in our 40s. It can actually start declining earlier because of our environmental toxicity and the sustained stress and nutritional deficiencies that we tend to be vulnerable to in our modern life. If you're overweight, and the best way to increase your testosterone level is to start losing weight. So general body habitus has an influence. The benefits to be gained for both men and women, but I'm talking about men today, is an enhanced sense of well-being. It's kind of hard to define more specifically, but it truly is something that is a mentally notable and remarkable experience. You just feel better overall. Your mood is improved, your energy's improved, you have less fatigue, you have increased strength and endurance, and an improvement in your body composition. So you'll notice an increase in muscle mass and strength, an increase in skin thickness, an increase in bladder tone, which as we get older becomes quite significant, and function, an increase in bone mass, which will both prevent and also help reverse osteopenia and osteoporosis, a thinning of the bones. There's decreased visceral fat, that tire that wraps around the middle of our abdomen, which consists of brown fat. It decreases because the metabolism of that brown fat improves. There's an improvement in libido and sexual function. And there's an improvement in cognitive functions, in memory and in sleep. There's an improvement in insulin sensitivity. And since diabetes is one of our most significant diseases impacting all aspects of health, including the greatest killer, cardiovascular disease for men, improving our insulin sensitivity with testosterone is remarkable. There's improved wound healing, and it helps to resist infections. And there's a definite documentable decrease in cardiovascular disease and associated metabolic risk factors, which include testosterone will increase the HDL cholesterol, the good cholesterol. It'll decrease the LDL cholesterol, the so-called bad cholesterol. It'll decrease your triglycerides, decrease your fibrinogen, decrease your insulin, and decrease your plasminogen activator factor 1. It also improves the vulnerability for autoimmune disease and is a great therapy if there is already prevalent autoimmune diseases such as rheumatoid arthritis, systemic lupus erythematosus, multiple sclerosis, variety of these conditions. A lack of testosterone leads to adverse physical, mental, and emotional changes. So why not replace and restore that which helps overall health and well-being? You don't want to wait till somebody feels sick in order to treat. This is where preventive medicine is so important for improving not only our longevity, but living well as we get older. Treatment goals are to enhance that sense of well-being, add life to our years, and prevent illness. When the total testosterone is over 500, then we see the impact on improvement of cardiovascular risk. You want to keep a range between around 500 and 1100, depending on the lab values. But that's the general range that I'm shooting for when I go for replacement therapy. You want to see a free testosterone that's unbound to the proteins that are carrying it through the bloodstream, around 30 to 40 picograms per milliliter, which is about 2% of the total testosterone level. There's a variety of ways to administer testosterone in men. The old gold standard is intramuscular, and that's a perfectly acceptable way to do it. Some people do not like to give themselves shots on a weekly or a bi-weekly basis. My preference is a transdermal cream rather than a gel. Gels tend to be, when they evaporate, a little irritating and drying for the skin. So I like to use a cream. And the dose is somewhere around 100 to 200 milligrams of the testosterone compounded in a cream that will absorb through the skin very well. And really the only significant caution when using a cream compared to using an intramuscular injection is that you want to avoid inadvertent transfer to your female partner or to your children. So you want to allow maybe 4 hours after you apply your testosterone cream, and the best time to apply it is after a bath or a shower, in order to allow for full complete absorption. And if you also have to be cognizant about the laundry, so that when doing the laundry, you can do the laundry yourself, guys, or if your wife does it, you may want to consider that she wears some gloves when she's putting your clothing into the washing machine. I don't particularly recommend patches because they tend to peel off and they can cause a skin irritation. They're not very user friendly. Personally, I don't like to use pellets. I don't like to use pellets for men. I don't like to use pellets for women, even though it gives a good, consistent level in the bloodstream. The problem is it makes you absolutely dependent upon having to have follow-up appointments with your physician every 2 to 3 months to get those pellets replaced. And it's a minor surgical procedure, making the cost, in my mind, prohibitive for the vast majority of men who could be eligible for testosterone replacement, but aren't necessarily very wealthy and able to shell out the bucks for that type of treatment, because generally this is not going to be covered by your insurance. You have to check your insurance, but most of the time when we're dealing with hormone replacement therapy, they don't cover that, and so it's out of the pocket expenses. And so I like to minimize those out of pocket expenses in a reasonable way. You can anticipate your sex drive will increase and be very noticeable, certainly by 4 weeks. The maximum effect will kick in by 6 to 8 weeks. If a man is less than or equal to 40 years old and they are having on a blood test a low testosterone level, I don't use testosterone therapy with someone between 40 and say 50 years old, or less than 40 and 50 years old, because it can cause a shrinkage of your the mass of your testes. It actually can lead to infertility, and if you're not finished with your family planning, then you certainly don't want to disturb that. In that case, I would use oral medications such as a Clomid, clomiphene, or HCG, which will stimulate the pituitary gland to increase the stimulation of testosterone from the testes. So in this circumstance, it becomes very important to increase the man's own ability to produce their own testosterone. And only if that is not successful, then we can consider using testosterone. I don't think that using testosterone in younger men is well advised, even though they often would like this very much because it does increase strength and endurance. But that it's always a cost-benefit ratio that you have to evaluate. Our pituitary glands are unfortunately suppressed by environmental toxicity, particularly plastics. Plastics will mimic the body's hormones and can disrupt the physiologic function in the body, and so can other types of medications such as SSRIs, which are commonly used to treat depression and or anxiety, prednisone, or Proscar and Propecia and Avodart, which are even available over the counter for treating male pattern baldness. We all want to keep a good head of hair. I'm already losing it on top. But using testosterone can actually aggravate that condition in younger men in particular. Therefore, I reserve the treatment of testosterone for men who are symptomatic and who have a documented lab value less than 500, in my opinion, for men who are over age 50. In order to dispel a lot of the misinformation and worries that are extant within our culture regarding testosterone, let me address them right now. Testosterone does not increase benign prostatic hypertrophy, which is an occurrence for almost all men as we get older. The prostate gland, which produces the seminal fluid for an ejaculate, will, as we get older, start to enlarge and encroach upon the urethra, the urine tube that traverses at the base of the penis. And as these cells get larger in the prostate, it can cause lots of problems for men, such as urinary hesitancy, frequency, and in a sense of an inability to completely evacuate the bladder. The good news is that testosterone replacement therapy does not increase benign prostatic hypertrophy. Similarly, it also does not increase the risk or cause prostate cancer. This is really a big concern because we're seeing more and more prostate cancer in men, and I think it is definitely associated to our lifestyle and our environmental pollution. And as a consequence, nobody wants to take something that's going to cause them to have cancer. Testosterone replacement therapy does not cause prostate cancer. Great news. However, because it can stimulate a cancer if it's there, it's important to be monitoring the prostate, the PSA, the prostate-specific antigen, which is a poor marker, but it's the marker that we have available most frequently to help determine if there's any suggestion of a problem with prostate cancer. As if the prostate specific antigen, the PSA, is greater than 4, that needs to definitely be evaluated by a urologist, maybe including an MRI scan of the prostate, maybe including prostate biopsies to be sure you don't have prostate cancer before there's any kind of thought of treatment, in order to not stimulate a cancer that might be there. If there's no suspicion of cancer, then using testosterone replacement therapy can be very beneficial. Testosterone will increase the red blood cell count circulating in the bloodstream. And this will cause on routine testing of your complete blood count, your CBC, an increase in your hemoglobin and your hematocrit. If that occurs, what I recommend, it's not a problem, but if that occurs, what I do recommend, and I recommend this for general health and well-being anyway, donate blood to the Red Cross. This will keep that hemoglobin hematocrit in a range less than 50, which will then keep the blood from sludging. Sludging of the blood is an independent risk factor for cardiovascular disease. And so you want to keep that below a hematocrit of 50. Testosterone will cause an increase in the hematocrit, but it's consistent with that of oxygen deprivation, say in the ski country of our United States. As one elevates, the body will adapt by increasing the oxygen carrying capacity within the bloodstream and therefore increase the red blood cell count. It never increases it to a dangerous level. This is not the disease of polycythemia, which is a disease. This is a normal physiologic response. Similarly, testosterone will create a normal physiologic elevation of hematocrit and hemoglobin, your red blood cells. And this is where donating blood is not only beneficial to you, but also to the blood supply in our country to help our fellow man. Now, switching back, things to not worry about. There is no significant weight gain with use of testosterone replacement therapy. There's no significant fluid retention, no associated high blood pressure as a result of testosterone therapy. It does not alter sleep apnea if you happen to have that as a condition. It will slightly increase your prostate-specific antigen, your PSA. As long as it stays below a 4.0 and does not have a continuous elevating rise, it is a non-issue to have any concern about. Testosterone in men is metabolized to estrogen. The higher the testosterone level in your body, the higher the estrogen level will be in your body. So if I am replacing testosterone, I can expect my estrogen level will also get elevated. This is not a problem. A low estrogen level is always bad in a man. In fact, most of the benefits that can be attributed to testosterone may well be due to the estrogen that's circulating as a consequence of the testosterone that is circulating. Estrogen has benefits. It's protective against cardiovascular effects. Lowering estrogen in men will increase risks of cardiovascular disease, lipid abnormalities, diabetes, colon cancer, memory loss associated with Alzheimer's, dementia, and other forms of cognitive dysfunction. It will cause bone loss, osteoporosis, a decrease in libido, and erectile dysfunction. So why on earth would I want to eliminate or decrease estrogen levels on a routine basis? I wouldn't, and I don't. If I'm concerned, I may recommend some mild estrogen blockers that are supplements over the counter. I do not routinely use Arimidex, which blocks estrogen in the body, because I don't want to eliminate the benefits of estrogen for a man. So that's generally how I look at testosterone replacement. There's great benefits to be had. It's anticipated and almost expected as we get older. Our hormone levels are going to decrease. My goal is to prevent and restore hormone normals in order to enhance well-being and decrease the risk factors for the development of degenerative diseases by restoring and replacing testosterone in men and not blocking estrogen because of the benefits accrued to using or having estrogen circulating in the body. That's what I wanted to talk to you about today. If you're interested, make an appointment to see us, and we'll be happy to evaluate you individually, because any use of hormones or any of our integrative medicine approaches are individualized. We use a thorough history to identify what are the concerns. We do laboratory screening in order to support a diagnosis. And when we treat, we insist upon, and it's good medical practice for acceptable follow-up to make sure that you're adequately treated and that your treatment is maintained within a good, healthy range so that you can enhance your well-being and increase your longevity and sense of fulfillment of all that your potential may be in this life. That's it for today.
Dr. Wile, excellent talk. Again, a lot of things I've learned. Yeah, actually, to our listeners, we have to understand this is a very critical part of our health. Hormones, we can consider hormones as actually, they are just messages. They are the command structure. The hormones are what our body, our brain, our body parts are telling what our cells and organs what to do. Without these hormones, without these messages, you can think of, for example, the United States. If you have a breakdown of the command chain from, let's say, White House all the way down, how chaotic we will be in this country. Oh, actually, we've been witnessing this for the last 2 years or so. So this is how hormone is. It's, I usually look at the health at like 3 different levels. At the cellular level, I call it the biochemical level, you need these nutrients. These nutrients are the normal components that include vitamins, minerals, trace minerals, and the macronutrients like the proteins, the lipids, these things. These are the individual foot soldiers. We need to have them to do the job. But who are they? Who are these? How are they going to function in an organized manner? These are the hormones. Not only the testosterone, but also female estrogens, thyroid, all this, So this is, we need to look at health and disease prevention in a holistic or integrative way, which is a major feature of these so-called alternative medicines, anti-aging medicine, functional medicine, that Dr. Wile has been talking for the last 2 sessions, and that's what we have been practicing. And but not to take too much of time, any diseases, including COVID-19, it's the same. Think about it. I understand our listeners may not have a medical background, but why only those people with underlying diseases and also tend to be a bit advanced age, they tend to get more severe COVID-19 disease and a higher mortality rate? In general, the virus is the same. It is the underlying health. So health and disease is not a single factor. It's how our whole body is. And, today, Dr. Wile excellently, elegantly discussed about the male hormone, which, again, I have been personally using, these androgen, because I'm an old man too, and I feel great. Like I mentioned, this is a integral part. And my father too, he's 87 now, and he still receives the testosterone therapy. Again, very good. And looking forward to the next lecture, Dr. Wile.
Next time, let's talk about the energy hormones and start looking at thyroid hormone, cortisol, and insulin in this package so that we can maintain our overall coordination of our body's energy systems.
Excellent, excellent. And I'll start, chipping as well, because when I finish, it'll be my busy schedule. All right, thanks again, Dr. Wile.